हाय फ्रेंड्स एवरीबॉडी हाउ आर यू। कैसे हैं आप लोग। नमस्ते। ऑल द वेरी बेस्ट टू ऑल ऑफ यू फॉर योर एग्जाम। मे गॉड ऑलवेज ब्लेस यू। All right, so let's go. This is the same PDF that we had used for the lab 2. We will be trying to revise together, and those who have just reading for the first time, have faith. It has all the key points. And at the end, I have something special as a Lodi gift for all of you. Number one, this will be a 2-hour class, 3 to 5. Number one, all the very best to all of you. Number two, happy Lodi to all of you from the entire team of Cerebellum, from the entire family. And thank you for the lovely hearts you are showering here. All right, so let's have a look at the first thing. Remember, there are a lot of scientists, but the most important is Thomas. So H.O. Thomas, he made two things. Thomas splint. Anybody, what was Thomas splint was made for? Tuberculosis of knee joint. Brilliant. So Thomas splint was made for tuberculosis of the knee joint. And what is the Thomas test for? Hip flexion deformities. Yes, you are correct. We are using the same PDF for all the lectures. All right. You did not miss anything. I am here, Abhi. So you did not miss me. So you did not miss anything. All right. Next, X-rays can show you everything except the cartilage. So what they can't show you is the cartilage. So cartilage is radiolucent. Also remember, C for cartilage, C for calcifications. So cartilaginous things will usually have calcifications. Also remember, cartilage, right, is showing you, right, calcified patterns on X-rays, whereas ossification is a specific uniform calcification. The most important mineral for the bone is calcium hydroxyapatite. Calcium hydroxyapatite, Ca10 PO46 OH2 minus. It is the formula for calcium hydroxyapatite, and the organic component is type 1 collagen 1. कार्टिलेज में कौन सा कोलेजन होता है बेटा? कार्टुलेज, type 2 collagen. Brilliant. All right, this batch everybody will score more than 200. Lot of people will be closer to 250. Promise. We are all watching. खेलेगा, end तक खेलेगा. You have to be focused throughout. Remember, the 3 joints that look up, they ossify at 18. Knee, wrist and shoulder. And remember, very commonly they ask you, knee and wrist are used for finding out the age of ossification at the age of 18 years. So knee and wrist at the age of 18 years. All right. So this is skeletal maturity, the age at which the epiphysis fuses with the metaphysis and the growth plate disappears. What is growth plate? Growth plate is physis. Physis, or the growth plate, is an area responsible for the longitudinal growth of the bone. If the physis is damaged, there will be growth alterations or deformities. Salter-Harris classification is for epiphyseal injuries in children. Type 1 is slip in the epiphysis. Type 2, the most common type, is a split of a metaphyseal part and a slip of epiphysis. Type 3 is a split of epiphysis. Epiphysis दो part में टूट गया. All right. Type 4 is a metaphyseal part with the epiphyseal split. Type 4. And type 5 is crushing of the growth plate, normal X-rays. The most common is type 2. This is called as Thurston-Holland sign. Thurston-Holland sign. All right. When we look at the types of epiphyses, joint forming epiphyses are called as the pressure epiphyses. And the areas which have got pull of a muscle are called as traction epiphyses. हमें यही दो जाननी है. Pressure epiphyses are covered by the cartilage. Traction epiphyses, remember what inserts at greater trochanter? Gluteus medius and minimus. What goes at the lesser trochanter? Iliopsoas. They will point an arrow and ask you the muscles inserting. What inserts in the tuberosities of humerus? The rotator cuff muscles. Supraspinatus, infraspinatus, teres minor, and subscapularis. Supraspinatus, infraspinatus, teres minor, and subscapularis. And subscapularis is called as forgotten tendon of rotator cuff. Forgotten tendon of rotator cuff. That is what is, right? Teres minor called as forgotten tendon of rotator cuff. This is what is very, very important. Going to next, the first movement in human body, atlanto-occipital joint, is yes movement. It says yes, flexion, extension. The second movement, atlanto-axial joint, is a no movement, left to right movement. Is the movement between C1 and C2, atlanto-axial movement. And the first movement is atlanto-occipital. So even human body is made positive. It has a positive mindset. अच्छी सोच लेके human body चलती है. All right. When I look at the hip joint or shoulder joint, the two joint movements which are very important. In the shoulder, the abduction. In the hip, the abduction. More importantly, in the shoulder, internal rotation. In the hip, the internal rotation. The thigh goes in, the leg goes out. This is internal rotation of the hip. Very important movement. So most of the time, this X-ray will be shown to you. And this image will be shown to you and they will ask you, what is the examiner trying to do? He's doing internal rotation. All right, of the hip joint. Remember that. All right. X-rays can show you the cortex, can show you the marrow, can show you the soft tissue planes, cannot show you the cartilage. So break in the cortex is fracture. When there is infection or there is swelling, the loss of soft tissue plane, that is the muscle and the fat plane separated by the deep fascia, is merging into each other. Remember, in compartment syndrome, you release up to deep fascia called as fasciotomy. This deep fascia is very important. Hello, Thomas. How are you? I am your fan too, Thomas. Thank you. All right. And then cartilage is called as the joint space. So normal joint space will show you a gap between the bones. Reduced joint space will lead to deformities like the varus. What is varus? Distal part towards the midline. Genu means knee, so genu varum. दोनों के बीच में O बनता है, called as genu varum, O. Right? And then when there is genu valgum, means it goes, distal part goes laterally. Valgus का है R, so it is RA. So RA will have genu valgum. Osteoarthritis will have genu varum. Usually varum deformities are more common in human body. That's how you should remember. Right? Tuberculosis will have loss of curvature of the spine. So our cervical spine goes in cervical lordosis, thoracic kyphosis, and lumbar goes in lumbar lordosis. These are normal curvatures of spine. In TB, there's spinal muscle spasm, paraspinal muscle spasm. There's loss of curvature of the spine, which is seen there. And remember, joint space is cartilage, not seen on X-ray. And reduced joint space का मतलब है cartilage getting destroyed, called as arthritis. I just want you to remember two words here, right? Bilateral hand pain, morning stiffness in a female is rheumatoid arthritis. Young man, low backache, reduced chest expansion, decreased lumbar movements, sacroiliitis, HLA-B27 positive, heel pain, red eye is ankylosing spondylitis. These are two things we should remember. If I look at the important joints and important points of the joints, shoulder is the most common joint to dislocate in human body because the head is 4 times the glenoid. Coracoid is a very, very important landmark. And coracoclavicular and acromioclavicular, these ligaments are very important for the shoulder stability, the arch of the shoulder. So many a times ऐसा होता है the clavicle goes very up. So there is a dissociation with coracoid and acromion. Coracoclavicular, acromioclavicular ligaments are torn. This is around shoulder. Around elbow, remember, capitulum is the first bone to ossify. They can point an arrow and ask you capitulum. And remember, anatomical snub box tenderness, the bone that ossifies at the age of 5 is scaphoid. And you need to remember crito as a mnemonic. Crito as a mnemonic. That is capitulum, radial head, internal epicondyle, trochlea, olecranon, external epicondyle. So this is the age of ossification of different parts. All right. So crito. Capitulum 2 years, radial head 4 years, internal or medial epicondyle 6 years, trochlea 8 years, olecranon 10 years, external epicondyle or lateral epicondyle 12 years, the age of ossification. And at the wrist, she looks too pretty, try to catch her. But what you need to remember is she is scaphoid at the age of 5 years. That ossifies at the age of 5 years. That is what you should remember. Sacroiliitis, radiographic sacroiliitis is one of the diagnostic criteria for ankylosing spondylitis. HLA-B27 is not a diagnostic criteria. Ankylosing spondylitis is a disease of young man, and sacroiliitis radiographic proven, most importantly MRI, is diagnostic. Upper end of femur makes an arch with the pubic rami of the pelvis. If there's a broken pelvis or the joint or the upper end femur, there's a loss of this arch called a Shenton's arch. CT scan will show you two things. C for CT, C for cortex, C for CT, C for calcification. Whereas MRI, M for MRI, M for marrow. So MRI will show you the marrow. Most of the diseases in orthopedics start in marrow. And that is why MRI is a very, very important investigation. In orthopedics, you usually get an X-ray done. If X-ray is not able to show you anything, you go to the MRI. You go to the MRI. All right? Cruciates. When we look at the anterior cruciate ligament, which goes anteriorly on the tibia, it's something which restricts hyperextension and internal rotation of the tibia on the femur. And posterior cruciate ligament, one of the most important ligaments of the knee joint, which limits external rotation. Also remember, my friends, cortex break is fracture. But what is stress fracture? It's a repeated force on a normal bone. And here what breaks is the marrow. And that is why for stress fractures, your investigation of choice is MRI. Remember that. Is MRI. When I look at the bone scan, this came in one of the FMGE exams. And you have this coming up in 3 days for you guys, that they had shown this image of the entire skeleton. Wherever you see black more, it means osteoblastic activity is more. This is called as bone scan blastic activity. All right. And can you tell me a tumor which has got osteoblastic activity as a metastasis? Prostate cancers. It has got osteoblastic mets. They love it in FMG exams. Also remember, if we want to look at overall the metastasis, PET scan is better investigation. It can pick up deoxyglucose, which is radioactive labeled with fluorine, and can show the activity. So stress fractures, overall investigation is MRI. Unilateral stress fracture, the investigation is MRI. But when they talk about bilateral stress fracture, bone scan is something which can tell you fracture where osteoplastic activity will be more, bone scan will be positive. Whereas when they talk about metastasis, single mets, MRI is very good. Multiple mets, PET scan. When osteoblastic mets, bone scan, because in osteoblastic mets, PET scan is quiet. It's silent. It cannot pick up anything. All right. Can you tell me the most common mets that come to the bone? They come from breast, followed by prostate, followed by lung. Can you tell me which area of the spine the mets goes to most common? Dorsal spine or thoracic spine. All right. Thoracic spine or dorsal spine. That's the commonest area where the metastasis go. Remember, if you have a presentation of pain, fever, and swelling, you can have two things in orthopedics. Either it's a malignancy or it's an infection, and both are confused further because both are metaphyseal usually. And how do you differentiate tissue? So the first investigation is X-rays. The next in orthopedics is usually MRI. But if the gold standard is to be asked, it's going to be tissue diagnosis. And this is what is written here in these two slides, which is the most important thing for you guys. Developmental dysplasia of hip is something which has a shallow acetabulum. And if you do not have a good acetabulum, the femoral head will automatically be out or will dislocate. An older time it was called as congenital dislocation of hip. DDH, the investigation of choice is MRI. Screening of the hip instability is done by ultrasonography. All right. When you talk about joints, when you talk about joints, in joints, the first investigation is always X-ray. The second investigation is always MRI because joint has got fluids. So the next is aspiration, which is done either by ultrasonography or arthroscopy. Which is the most common joint which gets infected? Knee joint. Which is the most common joint where you do arthroscopy? Knee joint. Which is the most common joint replaced in the human body? Knee joint. Which is the largest joint in the human body? Knee joint. That's why everything in human body is knee joint, and G joint. And this is what stress fractures are done. March fracture is a fracture of the second or the third metatarsal neck. In your books, they are given shaft, mark neck. In upper limbs, it's olecranon. In the spine, an area called as pars interarticularis. And the stress fractures are usually treated by cast or rest. And what is the investigation of choice for unilateral stress fracture? MRI. Overall, MRI. Bilateral, bone scan. All right. B for bilateral, B for bone scan. All right. In lower end of femur and knee joint, these are two very commonly asked images in orthopedics. All right. When they talk about periosteal reactions, sun ray appearance means multiple rays coming out can be seen in any malignant bone tumor, but usually osteosarcoma. Periosteum lifted up, a triangular piece of bone underneath, can be seen in any periosteal reaction, can be seen in any malignant tumor, chronic infections, but usually osteosarcoma. When you have multiple layers like an onion peel or lamellated appearance, can be seen anywhere, but usually Ewing's sarcoma. All right, so these are three important things that you should keep in mind. Remember, sun ray appearance and Codman's triangle can be seen in any malignant lesion, but usually it is seen in osteosarcoma. Onion peel appearance, any chronic infections or malignant lesion, but usually Ewing's sarcoma. Subabul, expanded bone with multiple cavities called as giant cell tumor or adamantinoma. Patchy calcification, I told you, cartilaginous tumors, they calcify. So chondrosarcoma more than chondroblastoma. Uniform calcification, osteogenic tumors. All right. So this is something which is very precious. This slide will make you smile if you remember. This will never let you lose the game. This is something which is very precious. So this is cartilaginous calcifications. This is uniform calcification of osteosarcoma. And this is a giant cell tumor. Remember, tumor of the lower end radius, till proved otherwise, is a giant cell tumor. Remember one more thing. The giant cell tumor goes till the joint. There is no other tumor that can involve the joint. Tumors, they respect the joint, they respect the cartilage. The only one which can go in the joint is the giant cell tumor. Giant goes to the joint. Right? Giant goes to the joint. This is very, very important. Biopsy is the gold standard. Remember, for tumors and infection, multiple metastasis, PET scan is preferred over bone scan. Bone scan is for prostate. In osteomyelitis, X-ray is usually the first investigation, but MRI is the investigation of choice. But which is the best one? Culture, the biopsy. All right, biopsy. Infections, remember, staph is the king. Infections comes through the blood, goes in the metaphysis. Staph aureus is the king. When you have sickle cell anemia, you have salmonella as the organism, and it's in the diaphysis. When you have got drug abusers or foot, it is Pseudomonas. Open injuries is again the Staph aureus. The most dangerous bites are the human bites causing Eikenella, and then the animal bites are Pasturella. When we look at the reduced movement of a child who's toxic, not eating, not sleeping, not doing well, you suspect infections of the bone. In the first 24 hours, the X-rays are normal. Beyond that, right, in the first 24 hours, the MRI and bone scan are positive. If you pick up osteomyelitis in less than 24 hours, treatment is non-operative, antibiotic, and the duration is usually 6 weeks. If the infection is more than 24 hours, X-ray will have changes. MRI is already positive, bone scan is already positive, and in such cases, surgery is done. Whether you operate or you don't operate, the duration of antibiotic is same 6 weeks. Which is the most common bone to undergo osteomyelitis? Lower end of femur. Lower end femur. So lower end femur is the most common bone undergoing osteomyelitis. All right. So femur lower end, again, very important question. When you have Faber and Faber, so these are two positions of the hip joint. Faber is flexion, abduction, external rotation of the lower limb. So flexion, abduction, external, seen in synovial proliferation, seen in joint infection, seen in polio, or seen in anterior dislocation. Anterior dislocation is very rare. What is more common? Posterior dislocation, which will have flexion, adduction, interrotation. This will always have shortening. And when there is actual destruction of the joint, it's arthritis. So if there is tubercular synovitis, I will have Faber. But if it progresses to tubercular arthritis, I will have Fadil. If there is septic arthritis, means pus in the joint, there will be Faber. But if this actually damages the cartilage, I will have Fadil. Right? Uske baad, posterior dislocation of the hip is more common than anterior dislocation. 90% are posterior dislocations. In joint infections, flexion, abduction, extension of the hip, 0 to 5 years, toxic child, high grade fever, high counts, absent movement of joint, septic arthritis. Organism is again Staph aureus. Treatment is surgical. Plus antibiotic for 6 weeks, whether it's bone or joint. The antibiotic duration is going to be 6 weeks. Order of investigation, X-mass, X-ray, MRI, aspiration. Aspiration is always done ultrasound guided. Whereas 6 to 12 years, you have transient synovitis. Kahin pe URI hua, cross reaction occurred, and proliferation of synovium occur. And this is self-resolving condition. So treatment is just rest. Remember, order of investigation will again be X-mass, X-ray, MRI, aspiration. All right, X-ray, MRI, aspiration. All right, this is what you should remember. To differentiate between septic arthritis and transient synovitis, Kocher's criteria is used. All right, next. This is femur epiphysis. It is destroyed because of infection called as Tom Smith arthritis. It is septic arthritis of hip joint in infants. All right. When you have subacute osteomyelitis, all right, your immunity is good. The body will try to contain it into one area. This is called as Brody's abscess. Subacute more than chronic. Lytic cavity surrounded by sclerotic margins. Lytic cavity surrounded by sclerotic margins. It is more commonly seen at the upper end of tibia. Very commonly asked image. When the bone becomes dead and isolated in a cavity, it's called a sequestrum. And that is diagnostic of chronic osteomyelitis. Chronic infections, you need to remove the sequestrum. And when you remove it, you will have a live bone that's called as paprika sign. Bleeding live bone. Whatever bleeds is alive, or whatever is alive will bleed. That's chronic osteomyelitis. In chronic osteomyelitis, you have a cavity in which you have a dead bone called as sequestrum. You have a reactive bone called as involucrum, and you have a draining sinus called as cloacae. When you have controlled the infection, you remove the dead bone, you see a bleeding point called as the paprika sign. And this particular instrument is called as the bone nibbler. One of the most common asked instruments in orthopedics, bone nibbler. Remember, when you're treating anything in human body, all right, when you're treating anything in human body, it's important to cover the wide structures with the soft tissues, like the cartilage, like the bone, like the tendons. All right. So that is why it is very, very important to remember this, called as vacuum assisted closure, called as VAC, used to cover the exposed bone. All right. It's a negative pressure wound therapy. Negative pressure wound therapy. All right. So you have negative pressures here. Remember, multifocal osteomyelitis. What is multifocal osteomyelitis? Right. What is multifocal osteomyelitis? Anybody? What is multifocal osteomyelitis? It's an infection, right, which is actually a misnomer of SAPHO syndrome. Synovitis, acne, pustulosis, hyperostosis, or osteitis. So it's actually an autoimmune disorder, but called as, all right, but called as multifocal osteomyelitis, and which is more common cause than sickle cell anemia or salmonella. Both are multifocal, but SAPHO syndrome, if it is given, you will prefer this. All right, infections of the finger. The most common infection of the hand is paronychia. Infection of the nail bed. Infection of pulse space of finger is called as phelon or whitlow. Very commonly asked. Infectious tenosynovitis is infection of the flexor tendon sheath of finger. And you have cannibal sign in it, where tenderness along the sheath is the most specific cannibal sign. It is the most specific cannibal sign. Remember that. Going to next. Orthopedics, the most common symptom is pain. Two painless conditions are mycetoma and Charcot's. These are two painless conditions. What is mycetoma? Is an infection of the subcutaneous tissue. So it has got discharging sinuses, fungal colonies come from it, but painless. It's called as Madura mycosis. All right. In tuberculosis, remember one thing, it comes from the lung. Again, through the blood. Difficult to isolate the bacilli. Tuberculosis, the spine is called as pot spine, followed by hip, followed by knee. SRK, Shah Rukh Khan. SHK, spine, hip, knee in orthopedics. Tuberculosis of the shoulder is dry. There is no fluid inside it. So called as Keri Sikka. Tuberculosis of the fingers, right, is called as spina ventosa. TB will always involve two vertebral disease called as paradiscal. TB will never involve a single vertebra. दो vertebras को involve करेगा. It will always be anterior to the neural tissue, so anterior disease. Whereas posterior elements and single vertebral disease is malignancy. All right. Remember that tuberculosis will have first the motor weakness, then the sensory involvement, then the urinary involvement. Remember, TB spine has pain, classically night pain, tenderness, and increased deep tendon reflex is the first neurological sign. In tuberculosis, the treatment is ATT plus rest and surgery only when indicated, called as middle path regimen, given by Professor Dr. S.M. Tulisa, my teacher. Indications of surgery in any disease of spine are bowel, bladder involvement, when the patient does not have control over the bowel and bladder activity, when there is worsening of the symptoms, right? And then there is no improvement. गणेशा चिंता मत करो, एग्जाम में ऑप्शन होंगे, आंसर याद आ जाएंगे मेरे बच्चे. अभी ये पढ़ लो, यहां से 10 क्वेश्चन आएंगे. एंड में 1 क्वेश्चन इज समथिंग विच इज एवरीथिंग. बात 149 पे अटक जाती है कई बार. ओके, तो ट्राई टू रीड व्हाट इज गोइंग ऑन हियर. लिव इन दिस मोमेंट फर्स्ट. टेंशन मेरे को दे दे, मैं संभाल लूंगा अगले 3 दिन, आप पढ़ाई कर लो. ओके, यू फोकस. ऑलराइट, आर यू विद अस? All right, going on. Remember that in tuberculosis, it is most important, it is very, very important, right, that it's a two vertebral disease. It's never a single vertebral disease. Okay, TB spine, all right, is paradiscal. TB hip usually starts from the acetabulum, commonest site, or it can be in the head, called as the Babcock triangle, the head of femur. Tuberculosis stage 1 is synovitis, synovial proliferation. There will be fever and lengthening. Stage 2 is early arthritis. That is flexion, adduction, rotation, and less than 1 centimeter shortening. If the question mentions patient has shortening, what stage it is? Stage 3, because 1 centimeter shortening is not appreciable. More than 1 centimeter is appreciable. All right. Then wandering acetabulum, destroyed femoral head, destroyed acetabulum, migrating femoral head from one corner of acetabulum to the other should be called as wandering femoral head, but misnomer called as wandering acetabulum. And finally, fibrous ankylosis. What is ankylosis? Ankylosis means pathological fusion of a joint. What is arthrodesis? Arthrodesis is surgical fusion of a joint. So tuberculosis of the spine has a bony fusion, no pain, painless. Tuberculosis of all other joints has fibrous fusion. Fibrous is painful, will have painful. All right. Now look here. Arthrodesis, surgical fusion, painless. Ankylosis, pathological fusion. Fibrous ankylosis, painful. F, seen in TB of the other joints, and RB as बीच में. RA. Bony ankylosis, solid fusion, painless. Like S for solid, S for septic arthritis, bony fusion. Spine TB, bony fusion. Spondylitis, ankylosing spondylitis, bony fusion. So spine usually have bony ankylosis. When you have a vertebra, it has 2 eyes, the 2 pedicles, and 1 nose, called as, right, 2 eyes, that's the pedicle, and 1 nose, the spinous process. If one of the pedicles is destroyed, means posterior disease, it's called as winking owl sign, seen in metastasis or malignancy. TB में नहीं होगा. TB is a vertebral disease. So it's a vertebra body disease. Paradiscal, 2 vertebrae are involved. Whereas metastasis, posterior elements. Pedicle is posterior elements. Single vertebral disease. All right. Tuberculosis of spine, there is loss of curvature. TB hip and knee, more vascularity because of inflammation, more resorption of bone called as periarticular osteopenia. When you are replacing joints, if you replace half the joint, it's called as Austin Moore, and Austin Moore में दो छेद होते हैं, fenestrated. Thompson, उसमें भी दो O होते हैं, but वो अलग अलग होते हैं, so it is not fenestrated, it does not have holes in it. All right, triple deformity seen in TB knee. There is posterior subluxation of tibia, external rotation of leg, and flexion of the knee, seen in TB knee. It is also seen in rheumatoid arthritis. Remember that. When I look at tumors, bone tumors, which are benign, will have well-defined margins, will have uniform consistency, either hard, either firm, either soft. Malignant tumors, ill-defined margins, right? And variable consistency, kahin par hard, kahin par firm, kahin par soft. Remember, epiphyseal tumors are chondroblastoma more than giant cell tumor, but epiphyseal tumor which is calcified, cartilaginous tumors will calcify, so it is chondroblastoma. It's also called as Codman's tumor. Upper end of humerus, unicameral bone cyst seen in metaphysis, or chondroblastoma seen in epiphysis, but unicameral bone cyst, single central cavity, single cyst is more common. Metaphyseal lesion, osteosarcoma. Diaphyseal lesion, osteoid osteoma. Adamantinoma, Ewing sarcoma. Osteoid osteoma, unicameral bone cyst. UBC means simple bone cyst or unicameral bone cyst. All right. Osteoid osteoma, adamantinoma, Ewing sarcoma. They are all vowels, as Zainab ma'am has told you. So they are all vowels tumor. All right. Epithelial tumors seen in tibia is adamantinoma. In mandible is ameloblastoma. Histopathologically, both are same. But just in 1985, they decided that agar tibia ka epithelial tumor hoga, it will be called as adamantinoma. And if it's a tumor of the mandible, it will call an ameloblastoma. Remember, there's a love triangle. Ameloblastoma likes mandible, but mandible's most common tumor is squamous cell carcinoma. Anakin classified bone tumors. Also remember, part affected is more important than the age in the tumors. Let's talk about the age. First decade, Ewing sarcoma is very common, but Ewing sarcoma, maximum number of cases are seen in second decade. But second decade, the most common tumor is osteosarcoma. There is a love triangle here. First decade likes Ewing's, but Ewing's loves second decade. So first decade ka sabse common tumor is Ewing's, but Ewing's maximum number of cases are seen in the second decade. Tumor which is seen between 20 to 40 or after skeletal maturity is called a giant cell tumor, and beyond 40 you have metastasis. When you're treating a tumor, when you open the cavity and clean it up, it's called as curettage, seen in unicameral bone cyst. When you put a chemical to decrease the chance of reoccurrence, it's called as extended curettage, done for different lesions. And when you remove that tumor from the central, the cavity of the center is called as intracapsular excision. When you remove from the margin or the pseudocapsule, marginal excision. When you take a normal cuff of tissue all around, what is that normal cuff of tissue? 3 centimeters called as wide local excision. And when you remove the whole bone, it's called as radical excision. Wide local excision is the most important one. It's a very, very important one. All right. Benign and cartilaginous tumors operated. Most common surgery, wide local excision, 3 centimeter margin. Cystic lesions like simple bone cyst, solitary bone cyst, or unicameral bone cyst, curettage, jharu lagana. Right? With a chemical to kill the cells, extended curettage. The most common chemical used is phenol. The most effective one is liquid nitrogen. Right? Like aneurysmal bone cyst, like chondroblastoma, like giant cell tumor, or and chondroma. So these are the most important tumors in which extended curettage is carried out. In malignant tumors, you have neoadjuvant chemotherapy. First, you give chemotherapy to a patient, followed by surgery, followed by adjuvant chemotherapy. And also remember, Ewing's is the most radiosensitive bone tumor known to mankind. It melts like snow with radiotherapy. Single central cavity, unicameral bone cyst called as fallen leaf sign. एक छोटा सा टुकड़ा बोन का नीचे मिलेगा. Multiloculated eccentric in tibia, aneurysmal bone cyst. Night pain relieved on taking aspirin or salicylate, osteoarthritis, a tumor of the cortex in the diaphyses. So CT scan is useful. Large to feel. When you touch a bone, you feel a bone. When you touch a cartilage, you feel a cartilage. So if there is a bony growth with a cartilage cap, you will touch the bone and the cartilage both. But small on X-rays because cartilage is not seen on X-rays. So large to feel, small on X-rays, osteochondroma. All right. And when the cartilage thickness is more than 2 centimeter, it means it has turned malignant. Epiphysis with calcification, chondroblastoma called as Codman's tumor. We just did that. And most common tumor of hands and feet is enchondroma. Right? So most common tumor of bones of hand and feet is enchondroma. So unicameral bone cyst, single central cavity, very big. At the bottom, if there is a fallen fragment sign seen in unicameral bone cyst. Aneurysmal bone cyst, multiloculated eccentric seen in tibia. And it's in the metaphysis. Night pain relieved on taking salicylates is osteoid. Osteochondroma is a bony growth with a cartilage cap. X-rays are not showing you cartilage. That is why large to feel small on X-rays. It's a developmental abnormality. Right? Most common tumors of bones in our hand and feet is enchondroma. There's hyaline cartilage. Right? When you have multiple enchondromas, it's called as Ollier syndrome. When you have multiple enchondromas with hemangiomas, with phlebolith, this is hemangiomas. This is calcified superficial veins called as phlebolith. It's called as Maffucci syndrome. And epiphysis plus calcification is chondroblastoma called as Codman's tumor. Lytic lesion that can go close to the joint or involve the joint is a giant cell tumor. Tumor of lower end radius is GCT till proved otherwise. The third love triangle. First love triangle. Ameloblastoma likes mandible, but mandible most common tumor is squamous cell carcinoma. Second love triangle. First decade likes Ewing, but Ewing's loves second decade. Third love triangle. Lower end radius likes GCT, but GCT loves lower end femur. So lower end femur, most common site for GCT. It is also the most common site for osteomyelitis. Remember that. It is also the most common site for giant cell tumor. So tumor of the lower end radius. It can also be seen in upper end tibia where it will go till the joint after maturity, or it can be in the upper end femur where it closely goes till the joint. Remember, GCT is after maturity going till the joint. ABC is before maturity and in the metaphyse. All right. Remember, when the bone is replaced by fibrous tissue, the upper end looks like a shepherd's stick called a shepherd crook deformity seen in fibrous dysplasia. G for girls, G for GCT, more common in females. F for fibrous dysplasia, F for females, more common in females. All right. This is also having a ground glass appearance on the X-rays. Hazy ground glass appearance. When you have precocious puberty, coffee colored spots, and multiple bones having fibrous dysplasia, it's called as McAcune-Albright syndrome. All right, Langerhans cell histiocytosis. Langerhans cell histiocytosis. All right, is histiocytic proliferation. It can destroy the bone or the lung called as eosinophilic granuloma. When they have got the cells have granules. The granules have tennis racket appearance. All right, the skulls have got lesions which are beveled. All right, and they disappear on their own. Something which is spontaneous resolution is something which is very good, right? As an MCQ point of view. When you have vertical striations on a bone, it is called as hemangioma or jail barn pattern. When you have unequal sized dots, it's called as polka dot pattern on CT scan. Identified on, right, hemangioma. So hemangiomas have these type of things. When they talk about destruction of a sacrum, it's a tumor arising from the notochordal remnants called as chordoma. Very, very important. Osteosarcoma is the cancer of the youth. All right. It is seen in the second decade of life. You give radiotherapy to a patient, and after 10 to 15 years, if you see a malignancy, it will be osteosarcoma. Osteosarcoma is a radio-resistant bone tumor. Radiotherapy does not work in it. Osteosarcoma is a bone-forming tumor, and it's a tumor associated with the retinoblastomas. In osteosarcoma, you have pain and night pain. Night pain relieved when taking salicylates, osteoma. Just mentioning night pain or pain, you should think about osteosarcoma. It is very common in the lower end of femur. All right. When you look at the treatment, methotrexate is the gold standard drug for it. Remember that osteosarcoma has a pulmonary metastasis and can cause pneumothorax. Remember this point. It can have pulmonary metastasis and cause pneumothorax. Three things in the lower end femur. Osteomyelitis, GCT, osteosarcoma. तीनों MCQs आते हैं. Ewing sarcoma, again in the femur but in the diaphysis. Again pain. Just like osteosarcoma can present like osteomyelitis. Again, second class, second decade of life. It's like a metastasis, it's a marrow biopsy required. Ewing's is a round cell tumor, blue color ka hoga. Glycogen positive cells. Translocation 1122 MCQ. MIG2, yeah, CD99 is a marker. Remember, in Ewing's, if you have fever, it's a poor prognostic factor. Ewing's again is in the femur. Treatment of Ewing's, give chemo, then surgery, then chemo, radiotherapy plus minus. Why radiotherapy plus minus? Because it has no effect on the metastasis of malignant tumors. First decade, onion peel appearance, diaphyseal lesion, Ewing sarcoma. Ewing's, remember, second decade more than first. Second decade, metaphyseal lesion, Codman's triangle or Sunday appearance, osteosarcoma. Metastasis, most common in breast, then prostate, then lung, dorsal spine. In skull, punched out, gadde gadde ban rakhe hain, seen in multiple myeloma. Multiple myeloma is a lesion of plasma cells. There is high ESR, multiple bone pains, and very high calcium. There are only two conditions which can have high calcium. One is multiple myeloma, second is primary hyperparathyroidism. There is no other condition classically which can have high calcium levels. Remember, when there is a large area of osteoporosis on the bone, it's called as osteoporosis circumscripta, seen in Paget's. And when there is deposit of calcium or cotton wool skull, again seen in Paget's. When you have, right, hair on end appearance, it is hemolytic anemia like thalassemias. All right, which is there. Sarcoidosis can have hypercalcemia, beta. I am talking about orthopedics. I just need to know multiple myeloma and primary hyperparathyroidism. Right? Nerve injuries. Remember one basic rule. Neuropraxia. If somebody had a drink and he leaned against the chair and he had a radial nerve palsy against the spiral groove leading onto wrist drop. Neuropraxia. After some time, it will 100% recover. So neuropraxia will have 100% recovery. Axonotmesis. It is also called as squash palsy or satellite palsy or honeymoon palsy. Neuropraxia of radial nerve. Most common nerve damage in the human body is radial nerve. Radial nerve damage will cause wrist drop, and it has a sensory supply on the first web space. Median nerve supplies the index finger. Ulnar nerve supplies the little finger. Electromyography is the best test for nerve recovery. Axonotmesis is damage to the axon sheath. If there is damage to the radial nerve, the first to recover will be wrist elbow extension, then the wrist extension, then the finger extension. This is recovery proximal to distal. This is axonotmesis, also called as Tinel sign is positive and progressive, also called as motor march. Human tissues, they recover at 1 mm per day. So if your Tinel sign, which is a sign of nerve recovery, recovers at 1 mm per day, it means everything बढ़िया हो रहा है, हर चीज बहुत अच्छी चल रही है. Right? Neuromesis is complete nerve transaction, no recovery without surgery. All right. Action of lumbricals, it makes the L in your hand. Like here, they have shown the first lumbrical supplied by the median nerve because the first two lumbricals are supplied by the median nerve, the other two are supplied by the ulnar nerve. Median nerve, ulnar nerve. When the lumbricals are paralyzed, it will lead on to claw hand. So they make a L in your hand. L banate hain lumbricals, L. L for lumbricals, they make a L. And when they are paralyzed, it leads to claw hand. The ulnar 2 will cause ulnar claw hand, the median 2 the medial claw hand. If both the nerves are involved, total claw hand. And when you're correcting the claw hand, you're bending the knuckles, called as knuckle bender splint for claw hand. All right. Remember that if your shoulder is damaged, axis nerve will be damaged and there will be sensory loss around the regimental badge area. When your spiral groove is damaged or the humerus is damaged, radial nerve is damaged, causing wrist drop and sensory loss in the first web space. Most common nerve palsy. If behind the medial epicondyle ulnar nerve is damaged, claw hand, knuckle bender splint. When around the head of radius a nerve is damaged, posterior interosseous nerve causing finger drop. The loss of wrist extension is wrist drop. Loss of finger extension is finger drop. Right? And when around the knee, common penile nerve is damaged, it knees on to foot drop, also called as high stepping gait. Remember one thing, that for the ulnar nerve, there are different tests, cart test, because ulnar nerve has palmar interossei adduct. The interossei are supplied by the ulnar nerve, palmar interossei adduct, called as cart test because they're holding a card between your fingers. If you move your middle finger to either side, the movement of the middle finger to either side is called as abduction. This is Igawa test, checking on the abduction. All right, when you give a book to a person and hold it between the thumb and the palm, you're using adductor pollicis called as a book test. When his adductor pollicis is paralyzed, he will flex his thumb to hold it, called as Froment sign. Remember, Froment sign is for ulnar nerve. Remember the mnemonic FU. All right, and when you have a little abducted finger, that's called as Wartenberg sign. So Wartenberg sign, all these are for ulnar nerve. These are the tests for ulnar nerve. Igawa means moving the middle finger to either side. If you're not able to do that, it means your dorsal interossei are not working. So it's for the dorsal interossei. Okay, Rajesh? All right. When you make a fist, if these two fingers stand out, it's called as a pointing index, median nerve. When a pope speaks, that's how he talks. It's called a benediction attitude. When you clasp your hands, if these two fingers stand out, it again means the same. The flexors of these two fingers, which are the median nerve, gone. When I give a pen to a patient and ask it to hold it between the thumb and between above the palm, and you ask him to touch it, this is pen test, abductor pollicis brevis. And your thumb is supposed to do opposition. If there's a median nerve palsy, it cannot do opposition. Thumb will be in the same plane as palm, called as ape thumb deformity. Median nerve has a branch, pure motor branch, called as anterior interosseous nerve. And an anterior interosseous nerve makes a vow in your hand. Wow. This vow is called as Kilo-Nevin sign, anterior interosseous nerve. All right, it's a pure motor nerve. All right, going on further. When your median and ulnar nerves are paralyzed, all right, it needs to claw hand, corrected by knuckle bender splint, more for ulnar nerve than the median nerve, because ulnar nerve palsies are more common than the median nerve. Similarly, when there's a radial nerve palsy, you will have a wrist drop, all right, and its correction is called as cock-up splint. When you have a posterior intraosseous nerve palsy, you will only have a finger drop. Remember that. Yeah, the question asked is, sir, what is OK sign? OK sign means anterior intraosseous nerve supplies the lateral half of flexor deuterum profundus and flexor pollicis longus. When these two join together, they make a wow. It means your flexor pollicis longus and FDP lateral half are working by anterior intraosseous nerve. This is called as OK sign or Keeler-Levin sign for anterior intraosseous nerve. In brachius plexus, you have C5, C6 nerve roots, right, which are responsible for, right, shoulder abduction and elbow flexion. If they are paralyzed, you have waiter tip or policeman tip deformity. Whereas C8 and T1 nerve roots are for the muscles of the hand. If they are paralyzed, you'll have claw hand. Which Erbs or Klumpke, which one will have Horner syndrome associated? Klumpke, so plus minus Horner syndrome. Which is more common? Herbs is more common. Very good. And whatever is more common will always have a better prognosis. Will always have a better prognosis. All right. Carpal tunnel syndrome is compromise of the median nerve, compression neuropathy of median nerve. It can be seen in pregnant. It is more common in females. So you have the Fallon's test. You have the reverse Fallon's test. Or you have a direct nerve compression test called the Durkal's test, which is the most specific. All right. Then you also have the the uh, the Guyon's canal syndrome, where you have ulnar nerve damage. You have cubital tunnel syndrome. You have again ulnar nerve damaged. You have piriformis syndrome, the sciatic nerve damage. Then you have got meralgia paresthetica, lacrycranial nerve of thigh damaged. You have chiralgia paresthetica, superficial radial nerve damage. Then you have thoracic outlet syndrome, where you have T1 more than C8 nerve root damage. And the tests for thoracic outlet syndrome are Edson test, Roos test, or Wright's test. Whereas Allen's test is for patency of the radial artery for cannulation. When we talk about trauma, fracture is break in the cortex. Sure sign of fracture is always abnormal mobility. Normal mobility occurs in the joint, but if the mobility is occurring between the bone, it's abnormal mobility. When there's a fracture, most common fracture is of the clavicle. Birth is again clavicle. In children, radius more than ulna. Most common joint to dislocate is shoulder anteriorly. In children is elbow posteriorly. And rarest to dislocate is ankle. And that is why the commonest area for ligamentous injuries is ankle. Talofibular ligament. Along the eversion injury means the ankle going out. The deltoid ligament is more commonly involved because talofibular is a lateral structure. It is damaged on the inversion movement. Most common tendon damage in human body is anybody? Supraspinatus. All right. The most common tendon is supraspinatus. When there's a fracture, there's blood around it called as hematoma. Over this hematoma, the granulation tissue comes, the vascularization comes, over which the immature bone called as callus comes. Callus is moldable but not displaceable. All right. Over which the mature bone or consolidation comes. At this stage, the bone is united, and over which the remodeling occurs, whether you cannot find out whether bone fractured. Remember one thing, that these stages are called as biological stages because there is a stage of callus, which is a cartilaginous stage. It is a stage of secondary healing because you are healing by forming a cartilage in between. Whereas primary healing क्या होती है? डायरेक्ट बोन से बोन जुड़ जाएगी, कैलस नहीं बनेगा. So secondary healing में कैलस होगा. Secondary में C है तो कास्ट लगाएंगे. When you put a cast is secondary healing. Secondary का स्पेलिंग में C है तो कैलस, कास्ट, N है नेलिंग. Primary healing में P है तो plating. Plating, there is no callus formation. If it is callus formation in plate, it means something is wrong. Supracondylar fractures are extra-articular fractures. They are away from the joint. You will take the patient to operation theatre, apply traction to it, confirm under the X-ray it's properly reduced, and fix it from a distance, called as close reduction plus K-wire fixation. Whereas lateral condyle fractures, right, is an intra-articular fracture. You will open it. Don't worry about the hematoma. In close reduction, you are preserving the hematoma. Close means hematoma in, open means hematoma out. Open reduction plus K-wire fixation. K-wires are stainless steel wires which are there. Remember, supracondylar fractures of humerus, right, in the early stages can lead to elevation of the fat pad because of hematoma, called as fat pad sign. Supracondylar fractures of humerus are very, very favored by the exam. More so in FMGE exam, they love it. Primary healing, P for primary, P for plating, no callus, non-biological. Secondary healing, C for secondary, C for callus, cast and nail. इसमें P नहीं है, so no plating. So here you have a, which one is stronger? This secondary healing is stronger because there's intermediate cartilage stage. All right, swimmers are prone to shoulder injuries, and subscapularis is called as a forgotten tendon of rotator cuff. Shoulder dislocation usually occurs anteriorly. In anterior shoulder dislocation, the head is down and arm is out, called as down and out. Whether it's hip or shoulder, there's a rule. Shoulder is the most common joint to dislocate because the head is 4 times the size of glenoid. There are tests for it, Dugas, Callaway, and Hamilton ruler test. And the most common maneuver to reduce the dislocated shoulder is Kocher's. The most common complication of a shoulder dislocation is a shoulder dislocation again. And remember, the most common nerve damage in shoulder dislocation is axillary nerve. The most common cause of a recurrent dislocation of a shoulder is a damage to the anterior glenoid labrum called as Bankart. Bankart is the anterior tier of the glenoid labrum. Or it's a posterolateral defect in the head of humerus called as Hill-Sachs. H for Hill-Sachs, H for humeral head. Posterior dislocation, the head is up, the arm is in. It is remembered by the electric bulb or empty glenoid sign because that's how the head looks like. And it is more common in the settings of epilepsy or electric shock. So epileptic patients and electric shock patients, posterior dislocation can occur. Remember, around shoulder axillary nerve is damaged, around humerus radial nerve is damaged, and it's not the commonest area to be involved in the spiral groove. In fact, the lower 1/3 area is more common, called as Holston-Lewis sign. What is Holston-Lewis sign? When the radial nerve pierces the intermuscular septum, it becomes fixed, and that's the area where it's damaged more. In supracondylar humerus fractures, you have anterior interosseous, the median, the radial, and the ulnar nerve. Remember that. Whereas in elbow dislocations behind the medial epicondyle, you have ulnar nerve. Cubitus valgus occurring in lateral condyle humerus, the distal part goes laterally. So behind medial epicondyle, the ulnar nerve is there, damaged more because it's occurring in the late stage called as tardy ulnar nerve palsy. Around the wrist, the median nerve. Around the hip, the sciatic nerve. And around the knee, the condylar nerve called as foot drop, also called as the high stepping gait condition. Montagia is a fracture of ulna with dislocation of radial head, and because around the radial head posterior interosseous nerve is there, it is damaged called as finger drop. So radial nerve causes wrist drop with sensi loss. Posterior interosseous nerve causes only the finger drop without a sensi loss. When a person falls on an outstretched hand, Overall, it fractures the lower end radius called as Colles fracture. In young people, it can cause pain in the anatomical snub box. You are correct, the scaphoid fracture. And then in children, it can be supracondylar fracture of the humerus, very, very common ones in them. Supracondylar humerus fractures, they undergo malunion and causes cubitus varus. Lateral condyle humerus causes non-union and undergoes cubitus valgus. Supracondylar fracture humerus, the order of non-involvement is anterosseous median radial ulnar. In cases of lateral condyle humerus, because of cubitus valgus, you have tardy or slow onset of palsy. Carrying angle is an angle between the arm and forearm. When it's reduced, it's called as varus. When it's increased, it's called as valgus. Cubitus varus in supracondylar humerus, cubitus valgus and lateral condyle humerus. The 3-point relationship around the elbow is the medial epicondyle, the lateral epicondyle, and the tip of olecranon. In this position, in the 90-degree flexion, they form a triangle, right? They form a triangle. This triangle is formed by the medial epicondyle, lateral epicondyle, tip of olecranon. In cases of supracondylar humerus, this triangle relationship is maintained because it's above these points. In cases of elbow dislocation, the 3-point relationship is disturbed. The 3-point relationship is disturbed classically in elbow dislocation. So this is fracture supracondylar humerus causing cubitus varus. This is fracture lateral condylar humerus causing cubitus valgus. Cubitus varus is also called as the gun-stock deformity. All right, remember that. Smith and Dunlop traction both are used for supracondylar fracture humerus. Both are used for supracondylar fracture humerus. Montagia is a fracture of ulna with dislocated radial head. When there is a fracture of radius with damage to the distal radial ulnar joint, is called as Galeazzi. Remember that Galeazzi is more common than Montagia. Galeazzi is more common than Montagia. So Montagia is fracture of ulna with dislocated radial head, whereas Galeazzi is fracture of radius with damage to the distal radial ulnar joint. What is more common? The Galeazzi. When there is a fracture of the lower end of radius, which is extra-articular, means away from the joint, with posterior displacement, it is called as Priyanka Chopra Colles fracture. What is the most common complication of Colles fracture? Anybody? Not carpal tunnel syndrome, not dinner fork, finger stiffness. Very good. So this Colles fracture, most common complication is finger stiffness, but it can lead on to malunion into dinner fork deformity. When the extra-articular fracture goes anteriorly, anterior matlab towards the thumb, because your thumb is anterior. This is called as Smith fracture. And in Smith fracture, the deformity because of malunion is called as garden spade deformity. So both Smith and Colles are extra-articular fractures. When the fractures align from the joint, it's called as a Barton fracture with the wrist movement. Whereas when there is a fracture of the styloid of radius, it's an intra-articular fracture called as Schopfer's. Whenever a father, right, rotates a kid holding from the hand, there's a traction of the elbow and the radial head pulls out of the annular ligament. All right. बच्चा रोता है, father हाथ जोड़ता है, mother is scolding the father. Classical sign. Age group of the child 1 to 4 years, classically 3 years they will give you in the question. Forearm is in pronation. There is nothing to worry about, just treated by supination. So treatment is forceful supination. That's how it gets corrected. Forceful supination. All right. When I look at the anatomical snub box, there is tenderness in scaphoid fractures. Scaphoid fractures at the waist. You apply a glass holding cast for scaphoid and hand shaking cast for Colles. In scaphoid, the blood supply comes from distal to proximal. That is why When there is a fracture, the proximal pole undergoes avascular necrosis, death of a bone due to poor blood supply. Whenever there's a bone which is dead, it will be white in color. White in color. When there are fractures of the base of first metacarpal, right, with a dislocation, it's Bennett's. It's due to the pull of a muscle called as abductor pollicis longus. When there's only a fracture, comminuted fracture of the base, it's called as Rolando. All right, sir, repeat Smith fracture. Smith fracture is a fracture of radius with volar displacement. Is anterior displacement extraarticular. All right. So dead bone is white. And when you hit a boxing, tuck, the neck of the fifth metacarpal is damaged. It's called as a boxer's fracture. Fifth metacarpal neck. Both Bennett's and Rolando are intraarticular. Both Bennett's and Rolando are intraarticular, just that Bennett's has a dislocation. All right. Let's take a break for 5 minutes before we continue. 5 minutes break. जो मन करे पहन लेना यार, कपड़े फर्क नहीं पड़ता, अच्छे कपड़े पहन के जाना। When we talk about dislocation, जब lunate आगे चले आता है, it's a lunate dislocation. Lunate stays, everything else goes is a perilunate dislocation. What is more common? Perilunate dislocation. Around the wrist, median nerve is more damaged. Right? When the lunate goes out, it's called as a lunate dislocation. Right? In lunate dislocation, ऐसा लगता है जैसे कप गिर रहा है. Spilled teacup sign or spilled pot sign. C for compartment, C for cast. Tight cast, compromise in the microcirculation, pain not relieved on anything, stretch pain from the distalmost extremity, deeper compartments of leg or forearm. If patient has got paresthesias or neurovascular compromise, do a fasciotomy. Pulselessness is the last sign. When you don't treat compartment syndrome on time, there will be ischemic contracture of the muscle called as VIC, Volkmann's ischemic contracture. It involves the deep flexor compartment of forearm. Most commonly involves the flexor digitorum profundus, flexor pollicis longus, MCQ. Order of involvement, anterior interosseous, median ulnar, AMU. And you give turnbuckle splint for it. Slowly, flexion deformities are corrected. If patient has an injury around elbow and Pelvan did a massage to him, there will be ossification occurring in the muscle of brachialis called as myositis ossificans. Treatment is immobilize for first 3 weeks. Then ask the patient to do active exercises on their own. Beyond 1 year, you will operate. If there's a Colles fracture and there occurs a sympathetic overactivity, it will show red hot shiny skin and osteopenia called as Sudex dystrophy or reflex sympathetic dystrophy. Treatment is continuous exercises. C for compartment, C for cast. M for myositis, M for massage. S for Sudex, S for sympathetic overactivity. If there's a femur fracture, after 48 hours, there is breathlessness, along with petechiae and confusion, that's fat embolism. Compartment syndrome occurs in the deep compartments. Myositis around the elbow. Sudex after Colles, and fat embolism after femur fractures. Elbow dislocation involves the posterior nerve, the ulnar nerve. Is the most common dislocation in a child. Remember the curvature of spine. The lumbar curvature is of a lordosis. Remember Cobb's angle tells about lateral curvature of spine with rotation called as scoliosis. Scoliosis can be idiopathic, most common type, don't know the cause. Can be postural if you do forward bending, disappears, called as Adams forward bending test. Or can be congenital when the structures of the vertebra are altered. 2 eyes and 1 nose are not seen. When there is complete spinal shock after a spine injury, there is no motor, no sensory response, and the first to recover is a bulbocavernosus reflex. If the terminal spinal cord is damaged, there will be a symmetrical loss called as conus medullaris. And when next to it the nerve roots are damaged, that's called as cauda equina syndrome. Jefferson fracture involves the arch of atlas called as JAT. Hangman is involvement of C2 over C3 called as H2. When you're going in a high speed vehicle and there's a sudden brake, right? You go back and then come front called as whiplash injury. And motorcycle injury is skull divided into 2 parts. When in a pediatric population, you call it as spinal cord injury without obvious radiological abnormality, it's called as Skywora. What is Crutchfield tongue? It's a tongue applied on the skull to pull the cervical spine. ये आ सकता है MCQ, आज तक नहीं आया ये. And Clay-Shawler's fracture is lower cervical spinal process involvement. Cheers. Trendelenburg test is testing the gluteus medius and the nerves for the hip stability. And Thomas test is for the hip flexion deformities. Examiners love it. FMG special. The head and neck of femur are above the trochanter. And if there's something damage to it and you measure the shortening, that's called as Brand's triangle. Black shirt nahi hai, par cup to black hai. All right. Thompson test is for tendo-Achilles tear. Right. This is an image of fracture neck of femur. This is an image of intertrochanteric fractures. Remember that the fractured neck of femur, all right, is known for avascular necrosis more than non-union. Very nice. Intertrochanteric fractures is known for malunion. Very nice. Yes, black coffee. All right. Remember, fractured neck of femur is classified by Garden classification or by Powell's classification. More proximal the fracture. This is how the blood supply goes. From the medial circumflex femoral artery, the retinacular branches go. More proximal the fracture, more chances of avascular necrosis. So subcapital fractures will have more AVN than transcervical fractures. Fracture neck of femur is called as the unsolved fracture. Less than 65 years of age, screw fixation. More than equal to 65 years, hemiarthroplasty. Whereas intertrochanteric fractures will have nailing, more common than dynamic hip screw. Femur, from the tip of trochanter, almost the entire length till the lower 1/3 is nailing is done. Femur, from the tip of trochanter, almost the entire length, nailing is done. Remember that. Gallows traction is used for fracture sharp femur less than 2 years of age. पुराने ज़माने में करते थे. Now this is not followed. It's not a good thing to do. All right. Thomas splint is for TB knee, now used for immobilization of lower limbs. Spica is the treatment of choice for a child less than 5 years with shaft of femur. Hip dislocation, posterior is more common than anterior. The nerve palsy in posterior is sciatic, and long-term complication is osteoarthritis. Remember, flexion, abduction, externodation, along with lengthening is anterior dislocation. Head is down, thigh is out, down and out. Excuse me, God bless you all. Right? So, this is Faber. Flexion, adduction, introduction, Fadir. It is posterior dislocation along with shortening, up and in. When you're going in a high-speed vehicle, there's a sudden brake, right? There's a strike on the knee. If it dislocates the femur, it's posterior dislocation, or if it damages the most posterior structure on the tibia, called as PCL injury. Both are called as, right? Both are called as the dashboard injury. So this is up and in. The femoral artery pulsations are felt against the head or femur. If the head is dislocated, you won't feel the pulsation, called as vascular sign of Nara positive. Tibial pylon fractures are the fractures of the lower end tibia involving the joint. Talus is an intra-articular bone. Above it is the ankle joint. Below it is the talocalcaneal subtalar joint. So it is known to cause osteoarthritis of the subtalar joint more than the ankle joint in the avian. Calcaneum, you measure the angle, called as bolars, lowers in fractures of calcaneum. Gizane, gains in fractures of calcaneum. Cobb's angle, we did that with an image, is for scoliosis. Kites for the man who worked on CTV. And Bowman's, all right, is for supracondylar humerus. Now, talus is the bone between the tibia and the calcaneum. So when the talus is damaged, the joint will get damaged, osteoarthritis will occur. So the more common type of osteoarthritis is subtalar than the ankle joint. Okay, Dr. Nick. Hanging cast is for humerus. Cylinder cast is for patella. Vrinda. Patellar tendon bearing cast is for tibia. आ जाओ, ऑल द बेस्ट कह दो सबको बेटा, सारे फ्रेंड्स कह रहे हैं आपको. Right, she wants to go to tennis, but before going to tennis, she said, I want to wish all of you all the best. She says that you have got exam on 17th and she feels that all of you will rock. All right. So handshaking cast is for colis and glass holding cast is for scaphoid. All right. These are important casts. They can come as theory. They can come as images. All right. Dunlop traction is for supracondylar fracture humerus. Clavicle fractures, which fractures the middle 1/3, is figure of 8 bandage. Mallet finger, which is avulsion of extensor tendon from distal phalanx. Come, beta. Wish all of them. Come here. Say all the best to all of them.
All the best.
Bend down. Ab dikh nahi rahe bete.
All the best.
They have an exam on 17th. Bolo.
All the best for your exam on 17th.
You will cross more than 200.
You will cross more than 200.
Maybe 250.
Maybe 250.
God bless you.
God bless.
And wish them what festival is today?
Happy Lodi.
Chalo, bye. Run. Bye, Vrinda. All right. So she was after my life. So avulsion of extensor tendon, she wanted to wish all of you. That you wanted to wish all of them. Say bye.
Bye.
Bye, beta. All right. So avulsion of extensor tendon from distal phalanx is mallet finger, and in mallet finger you apply a splint for 6 weeks. In orthopedics, if you don't know where to apply, how much time to apply a splint, 6 weeks. All right. This came in January FMGE exam. Baller bronze splint is for femur, knee or tibia immobilization. All right. सब बच्चों ने बोला सर ऐसा लग रहा था बेड लगा हुआ, तो बेड लगा हुआ है देखो पैर के लिए. All right. Russell traction is for intertrochanteric fractures. Agnes Hunt is for flexion deformities of the hip joint. Milwaukee brace is for the scoliosis. It goes till the chin. Jefferson's is a fracture of atlas. Hangman is fracture of the C2 cervical spine. Nightstick is a fracture of the ulna. Isolated fracture of the ulna. Schoffer's is a fracture of radial styloid. इनमें से कोई भी इमेज आ सकती है आपको. All right. Colles is posterior displacement of the distal end radius. Bucket handle in the pelvis. If there's a damage anteriorly on one side and posteriorly on the other side, it's called as bucket handle fracture. When the anterior pelvis opens up, it's called as open book fracture. And when there's a fracture anteriorly and posteriorly on the same side, it's called as Malgaigne fracture. Right? The pubic rami, when you're riding a horse, the horse's straddle strikes against it. So pubic rami fracture occurs, called as straddle fracture. Okay, somebody asked me, what is Jefferson? Jefferson's is the fracture of the atlas, C1 vertebra. All right, pylon, we did that. Intra-articular fracture of lower end of tibia. Aviators is neck of talus fracture. And Jones and pseudo-Jones are fractures of the base. Pseudo-Jones is just the tip of fifth metatarsal. Jones is metaphyseal-diaphyseal junction. And you immobilize them for 6 to 8 weeks. Open book means the pubic symphysis opens up anteriorly. All right, proximal humerus fractures. Image given. This is supracondylar fracture, humerus, posterior displacement. All right, the classification for supracondylar humerus is Gartland classification. All right, this is Galeazzi, fracture of radius with damage to distal radial ulnar joint. This is Montegia, fracture of ulna with damage, dislocation of the radial head. And this is boxers, mukka marte hain, neck of fifth metacarpal. bumper, when you're going in a when you're walking on the road and somebody hits you with a car bumper, the lateral tibial plateau fractures, and whatever area fractures, जब lateral side जाएगी तो valgus होगा, चाहे lateral tibia हो, चाहे lateral part of the condyle of humerus हो, it will cause valgus. When there is damage to the medial malleus, the lateral malleus, and the posterior malleus, it's called as a trimalleolar fracture. When there's a fracture of the medial and the lateral malleus, bimalleolar fracture. When there's an involvement of intertarsal area, it's called as Chopard's dislocation. When there is involvement of tarso-metatarsal area, it's called a Lisfrank's injury. All right. And when there is, my friends, when there is involvement of the neck of second or third metatarsal, it's called as March fracture. Runner's fracture involves the lower part of fibula. All right. When you apply traction to the skin, you can pull up to 5 kgs. But when you apply the traction to the bone, you can go up to 20 kgs. Both are your MCQs. Open injuries, external fixator is applied. Tension band wiring is done for fractures of patella. You tie with a wire and a K-wire, patella, olecranon, and the medial malleus. 3 fractures. For these 3 fractures, tension band wiring is done. You tie the area where the muscle is pulling out and tighten it up. Chopard says intertarsal area, Anushka. When you apply a plate to a surface, you are doing it a primary healing. You will hold it with the screws, and as you tighten, the bone will unite, called as dynamic compression plates. You are seeing that when you were applying the plates, the blood supply was getting damaged. So you cut a groove inside it. So these are called as dynamic compression plate, DCPs. When you were committing grooves in it, it was called as limited contact dynamic compression plate for vascularity and come. Problem with these plates was the screws, which were either cortical screws in the cortical bone or cancellous screw in the cancellous bone. They were coming out. So what they did was they made threads in the screw head and threads in the plate. Now these threads will lock to each other, and thus now the screw cannot come out. इसे बोलते थे लॉकिंग प्लेट. दे वर स्ट्रॉन्गर कंस्ट्रक्ट. अब पूरी प्लेट को बाहर निकलना होगा. वेरी वेरी डिफिकल्ट फॉर इट टू कम आउट. All right, which was used for the weaker bones or the weaker areas of the bone. Very, very important for you to remember. When you use an instrument to cut the bone and align it, osteotome. This is the jhadu of the bone called as curate. This is the cutting of the bone called as bone cutter. This is the most commonly asked instrument, nibbler. Whenever anything has only tooth surface, it is called as bone holding. When one surface is bone holding and the other is when one surface is bone holding with the grooves and the other is smooth, it's called as bone and plate holding. So these are separate fragments which are there. Bone holding and plate holding. When you are fixing the bone, long bones, you use nails called as interlock nailings. And for open fractures, you have fixators. When you apply it circumferentially, most stable, Elizarov. Then there's something called as a rail fixator, less stable than Elizarov. And when you apply in normal fixators, they are least stable. So this is the stability. One plane fixation, multiple plane, rail more stable, Elizarov 360-degree more stable. All right. This is an image of patella, which is bipartite patella. In the skyline view, you will be able to see it. Osteoarthritis involves the distal interphalangeal joint. Rheumatoid arthritis, distal interphalangeal joint is spared. ऐसे याद रखो. OA. मजा आ रहा है मुझे आज. So when you say OA, in OA, the two joints that point towards him are involved in OA. DIP and PIP, OA. When you say RA, acha marks RA, means PIP and MCP are involved in RA. So OA, RA, OA, RA. So DIP is paired in RA and MCP is paired in OA. ये main game है. So in osteoarthritis, MCP is paired. First carpometacarpal joint is involved in osteoarthritis. In knee, in osteoarthritis, medial compartment जाएगा, इसीलिए वैरम आएगा, O बनेगा, वैरम. In RA, वैल्गम आएगा, पढ़ा था हमने, right? MCP is commonest involved in RA, knee is genu-valgum. Swan neck and bottom deformity along with ulnar deviation is occurring in RA. Young female bilateral hand pain is RA. In osteoarthritis of knee, genu-valgum occurs. Most commonly wasted muscle is quadriceps. अगर एक व्यक्ति अपने दिनचर्या के काम नहीं कर पा रहा, not able to do its activities of daily living, and is young, cut the bone, correct it, high tibia osteotomy, less than 60. If the age is 60 or more, do a knee replacement. Open reduction is for joint injuries. Closed reduction is for extra-articular injuries. Sacroiliitis. Young male, decreased chest expansion, bamboo spine, dagger spine, trolley track sign, ankylosing spondylitis, HLA-B27 positive. Middle-aged man, businessman, great toe inflamed, gout. Uric acid crystals deposition when you throw a light, negatively birefringent. Needle-shaped crystals. Charcot joint seen in diabetic, loss of proprioceptive fibers, midfoot involvement, painless. Totally destroyed joints. ये osteoarthritic hand है. There are Hubbardon nodes in DIP, Bouchard's nodes in PIP, and first carpometacarpal joint is a very commonly involved joint. In OA, the medial compartment of the knee is involved. Quadriceps is the most commonly wasted muscle. It leads to genu-valgum. Genu-valgum. If the patient is less than 60, you take out a wedge of a bone, more on the lateral side, less on the medial side, and straighten it. High tibial osteotomy. If the patient is 60 or more, you do a replacement, which has an excellent result. In RA, you can have flexion of the DIP and hyperextension of PIP called as swan neck deformity, or you can have hyperextension of PIP and flexion of DIP called as buttonhole deformity. Both are seen in RA. In RA, you can also have ulnar deviation of fingers, which is very commonly asked. In psoriasis, you have DIP involvement, and it causes pencil in cup deformity, as if there is pencil in the cup. This is seen in psoriasis. All right. Then you have resorption of the terminal tuft of phalanges seen in scleroderma, or totally destroyed hands called as arthritis mutilans, again seen in rheumatoid arthritis. Very, very common. All right. This is sacroiliitis, ankylosing spondylitis. The supraspinous and interspinous ligaments are calcified, causing an inverted knife or dagger sign. When the facet joints along with the interspinous ligaments is calcified, called as Strally-Trox sign. Or when there is resorption of the corners of the vertebra, Romanus sign. The vertebrae can be fused together, leading into bombo spine. When there is intervertebral disc calcification, you are dealing with alkaptonuria. And remember, my friends, when your intervertebral disc is calcified, your ligaments are calcified, your bones are ossified, that's bamboo spine, ankylosing spondylitis. But when only the anterior and the posterior margins of the vertebra are calcified and the intervertebral disc space is normal. That's called as Forestier's disease or diffuse interstitial skeletal hyperostosis. Diffuse interstitial skeletal hyperostosis. Inflamed great toe is gout. You will have uric acid crystal deposition, which are negatively bifurcated and needle-shaped. There will be history of erosions of the bone or overhanging bone at the first MTP, which is called as Martel sign. Neuropathic joints or Charcot joint is totally destroyed anatomy. You can't resemble it. But when there is calcification of the meniscus or chondrocalcinosis, this is called as pseudo-gout. All right. Widened intercondylar notch is hemophilia. Most common cause of loose body, osteoarthritis. Most common cause of multiple loose bodies, synovial chondromatosis. Coxa vara, reduced neck shaft angle of femur. Coxa valga, increased neck shaft angle of femur. When there is widening of the bony ends is rickets. When the bony ends become white, either in the metaphysis called as white line of Frankel, or the epiphysis is thickened called as Wimberger ring sign, where everywhere in the bone it's resorption, along with blood-filled cavity which becomes brown, or dots on the skull called as salt pepper skull. You're dealing with hyperparathyroidism. When there is an osteoclast defect, it's called as Paget's. Most common symptom is pain. Most common involved bone is pelvis. And then a vertebra become white as a box called as ivory vertebra. Or they can be deposits on the skull called as cotton wool skull. This is all Paget's. Paget's is multifactorial, but there's one more disease which is an osteoclast defect only called as osteopetrosis. It will have alternate bands of white and dark called as rugby colored spine, rugby jersey spine. Rugby players, they wear striped t-shirts. Classical rugby jersey spine is seen in renal disorders, but it can also be seen in osteopetrosis, a disease which does not have a bone marrow, right? And it's called as a marble bone disease because the bone looks white as a marble. When the DEXA scan, you calculate T-scores, osteoporosis is less than minus 2.5 of score, and you have codfish vertebra, which can be seen in osteoporosis and osteomalacia. Both screening of the bone quality is done for more than 65 years in female and more than 70 years in cases of males. Osteogenesis imperfecta is type 1 collagen defect. This is beading in rickets called as rachitic rosary. In rickets, you have cupping, you have widening or splaying, and the bony ends, they look out called as flaring. When you give calcium vitamin D, the rickets heal and there's a white line formed called as white line of Frankel. So in rickets, basically you have widening. The adult counterpart of rickets is osteomalacia, which will have protrusion of the acetabulum inside called as protrusoacetabulum. Will have coxa vara, reduced neck shaft angle of femur, or pelvis looks like a triradiate called as triradiate pelvis. This is osteomalacia, adult counterparts of a rickets. In rickets, you can have varum or you can have valgum. Whereas scurvy is whitening, always will have white line of Frankel. In rickets, white line of Frankel is only seen when there is healing rickets. In scurvy, it is always seen. Along with that, there is Wimberger ring sign in scurvy. Wimberger ring sign means sclerotic margin of the epiphysis. That is seen in scurvy. So scurvy का skeleton white है, rickets का wide है, metaphyseal widening. Lamina dura is the lining of tooth socket. It's lost. Where is it lost? in hyperparathyroidism. What all do you see in hyperparathyroidism? Salt, pepper, skull. Hyper PTH. The bones can look like a rotting fence post. Hyper PTH. It can also have gaddas, which on histopath gives a brown color because of the blood degradation product. Hyper PTH. So all these are features of hyperparathyroidism. The classical features are abdominal groans, psychic moans, renal stones, and bones. Lysis everywhere in the bone. When there is enchondral ossification defect, it's called as achondroplasia. They will have bullet-shaped vertebra, champagne glass pelvis, limbs are short, limb dwarfism कहते हैं इनको. Trunk same size है. Appu Raja, Kamal Hassan, short height, Dasvi, Chotu. They're very intelligent people, achondroplastic. They have trident hand, achondroplasia. Or all their bones, all their fingers are equal sized. Starfish hand. Whereas when you don't have clavicle and your skull is not developed, it's called as cleidocranial disorder. So shoulders can meet in the midline, absent clavicle. When you don't have a marrow, your bone looks like a marble. It looks as if there's a bone within a bone appearance, which is also seen in sickle cell anemia. This is osteopetrosis. It also has alternate bands, as told to you, rugged jersey spine with classical of CRF, given here. Erlenmeyer flask deformity, classically seen in Gauchers, can also be seen in osteopetrosis. In an age group of more than 50, with pelvis as the most commonly affected bone, pain as most common symptom, Paget's disease is there, called as osteitis deformans. They will have very high alkaline phosphatase levels. In Paget's, your vertebra boundary can be thickened, called as picture frame vertebra. Or you can have a vertebra which looks wild, called as ivory vertebra. In Paget's, you can have cotton wool skull. Patient will have increasing head size or large resorption of the bones, called as osteoporosis circumscripta, or thickened pelvis, called as a pelvic brim sign. Also flame appearance in the cortex of the long bones, blade of grass or flame appearance. All this is Paget's. Whereas in osteoporosis, where calcium phosphate ALP are normal and that acid phosphatase, which is a bone resorption marker, is high, you can have codfish vertebra, where the intervertebral disc looks like a fish. Bone is crumpled. Osteogenesis is imperfect as a crumpled skeleton because of type 1 collagen defect which forms the bone. So, rugged jersey spine, CRF. Bamboo spine, ankylosing spondylitis. Codfish vertebra, osteoporosis. Bullet nose vertebra, achondroplasia. Ivory or picture frame vertebra, Paget's. And blue sclera, osteogenesis imperfecta, is something that everybody should. Yeah, the drug of choice for Paget's is bisphosphonates. If somebody's hand comes under a car and he wants to know the survival, it will be done by the mesh score. If you want to fix up any amputated part of a body, fix the bone first. When you have amputation of a foot and you want to replace it with a natural looking foot which can squat, it's Jaipur foot. When you have an artificial foot which can't squat, it is a Sach foot. In the knee joint, on the flex knee with rotation, the menisci get damaged, medial meniscus more than the lateral meniscus. In a knee joint, on flexion with rotation along with the valgus force, anterior cruciate ligament goes. ACL has two fibers. Posterolateral fibers are more important because they help in walking. Why? Because ACL's main function is to prevent tibia going anteriorly on the femur. The most important test for ACL is ACL, the latchment test. Other tests are anterior draw, pivot shift, and lady. When we look at the dial test, is for posterolateral corner, is for PCL. On a flex knee, when you rotate, that's the dial test. Frozen shoulder is a complication of diabetes where your capsule sticks on. Patient has classically night pain and treatment is plan A. What is plan A? Plan A का मतलब होता है rest plus NSAIDs. If not relieved, local steroid, not oral, local steroid if not surgery. So, lot of conditions you do this. Tennis elbow is lateral epicondylitis, inflammation of the lateral epicondyle. Treatment plan A. Golfer's elbow, medial epicondylitis, treatment plan A. Student's elbow, olecranon bursitis, treatment plan A. Housemaid's knee, very commonly asked everywhere, prepatellar bursitis, treatment plan A. Clergyman's knee, infrapatellar bursitis, treatment plan A. Mnemonic is PH, prepatellar bursitis, housemaid's knee. Most common tendon injured, we had a word, supraspinatus, then biceps, then tendinoachilles. Then biceps injury causes a Popeye here in the front. Hallux valgus, image aati hai, lateral deviation of the great toe. First 60 degrees of shoulder painless movement, abduction. 60 to 120 painful, called as painful arc syndrome. Treatment plan A. We did this. Mallet finger, avulsion of extensor tendon from distal phalanx. Treatment is splint for 6 to 8 weeks. Whereas Jersey finger is avulsion of flexor profundus. Treatment is surgical. Opposite है दोनों का. All right, treatment is surgical. This is Sach foot, artificial foot, Jaipur foot by Dr. P.K. Sethi, allows to squat and looks normal. All right, anterior draw test, ACL, 90-degree flexion. Latchment test, ACL, 20-degree flexion. Dial test, PCL. Pivot shift test, ACL. When you take your knee into varus, you are testing for the lateral collateral ligament. So lateral collateral ligament, varus test. When you take your knee into valgus, medial collateral ligament. PCL restricts external बात हो गई. ACL restricts hyperextension rotation, बात हो गई. MAM is dangerous. A dangerous triad of the knee is MCL, ACL, and medial meniscus. When there's a damage to these three structures, it's called as a dangerous triad of the knee. The blood supply of the meniscus बाहर से अंदर आता है. इसीलिए the outer 1/3 can be repaired, inner 2/3 has to be repaired. What is plan A? Plan A का मतलब है rest plus NSAIDs. Give that. NSAID means non-steroidal anti-inflammatory drugs. If there is no relief, you put a local injection of steroids. If no relief, you operate. Flexor tendon zones. When you have flexor tendons in zone 5, they are in the forearm. Zone 4 is in the carpal tunnel. Zone 3 is in the lumbricals. Zone 2 is in the flexor digitorum superficialis. Lots of pulleys are there. So it is an area which is called as a no man's land. And zone 1 is for flexor digitorum profundus, FDP. All right. When you have a disc prolapse, most common level of disc prolapse occurs between L4, L5. MRI is the investigation of choice. It's always a rule that the lower nerve root is compressed. So अगर L4 और L5 का disc prolapse होगा, कौन सा nerve root compress होगा? L5, very good. Sciatica कहते हैं इसको. Pain going down the leg. All right. When you have, look at the oblique or lateral view of the spine, right? When you have a look at the oblique or lateral view of spine, you see a dog. The ear of the dog is the superior articular process. The front leg of the dog is the inferior articular process. In between the two is an interarticularis. This area is very weak. Whenever any injury goes, it goes in this area. So whenever a vertebra has to break, वो यहीं से टूटेगा. Vertebra को बोलते हैं spondylo, टूटने को बोलते हैं lysis. Spondylolysis means L5 vertebra. It's called as a dog with a collar in the neck. And when the neck breaks, the head falls, called as beheaded dog, seen in slip of one vertebra over the other, spondylolisthesis. Most common level of spondylolisthesis is L5S1. All right. So disc prolapse is sciatica, MRI AOC, L4, L5, lower nodal compressed. L4, कुछ लोग पूछ रहे थे what is plan A, rest plus NSAIDs, if not relieve local steroid, if not relieve surgery. ये रहा बेटा. कुछ की इच्छा लिखा हुआ देख के पूरी होती है. All right. So L4 nerve roots supplies the tibialis anterior, that is ankle dorsiflexion and middle part of the leg. L5 supplies the extensor hallucis longus, the extensors of the thumb. And S1 supplies the flexor hallucis longus, the flexors of the thumb. Spondylolisthesis is slip of one vertebra over the other, that is L5S1, beheaded dog. Spondylolysis is break in interarticularis, dog with a collar in the neck. Gamekeeper's thumb is avulsion of or damage to the ulnar collateral ligament of the first metacarpopharyngeal joint. This is tennis elbow. All right. When you have the first extensor compartment of the thumb, abductor pollicis longus, extensor pollicis brevis, right, and you put it inside and you make a fist and you take it towards the ulna. This is called as Finkelstein test. Treatment is plan A. Very painful. Normally अभी आपको stretch feel हो रहा होगा, but अगर किसी को decurvence होगा, very painful. Haglund deformity is prominent calcaneal tuberosity. All right, Dupuytren's contracture again seen in diabetic, alcoholic, HIV positive or tubercular patients. There is contracture of the palmar aponeurosis and flexion deformity of the ring and little finger. All right, mallet finger I've told you is avulsion of extensor tendon, and jersey finger is operative avulsion of flexor labrum profundus. When you have osteochondritis, means bone along with overlying cartilage fragmentation. When there is osteochondritis or lunate, it's called as Kienbock. All right. When there is osteochondritis of navicular, it's called as Kohler. When it's osteochondritis of the vertebra, it's called as Sherman's. All right. And remember one more thing, lateral deviation of great toe. This is hallux valgus. A, vascular necrosis, death of a bone due to poor blood supply. Very common in smokers or steroids or alcohol intake. Steroid is the key point. Dead bone looks white. Involve the head of femur, proximal pole of scaphoid, or the head of humerus, where it's called a snow cap sign. Right? Why it occurs in this area? Because blood supply ऐसे जाता है. Blood supply ऐसे आता है, distal to proximal. The most important blood supply to the head of femur is medial circumflex femoral artery, retinacular vessels. It affects the anterolateral aspect of the head. और चंदा मामा दिखता है. जब भी avian of the head होता है, चंदा मामा दिखता है. All right, sectoral sign is also there. MRI is investigation of choice in this condition. ये क्या है? Popeye. Long head of biceps gone. Remember, painless limp occurs in the age group 4 to 8 years per avian of the head of femur. Slipped capital femoral epiphysis occurs in the age group of 11 to 20. Overweight. Hypothyroidism. And CTV is called as club 4, in which Pirani scoring is carried out. In DDH, class खत्म होने वाली है 5-7 मिनट में. There is shallow acetabulum. And ortolani is hip को अंदर लाना, abduction. Barlow. This location is Barlow's test. You maintain the hip abducted by Pavlik harness or Pavlik harness wound on splint or Bacillus cast. Investigation of choice for DDH is MRI. Perthes is avascular necrosis of the femoral epiphysis. You will have Chanda Mama, recent sign. या अपर एंड फीमर पे एक सैगिंग रोप दिखेगी और दे कैन बी लाइसिस कॉल्ड एज गैगेज साइन ट्रीटमेंट इज मेंटेन abduction painless 4 to 8 years congenital muscular torticollis is tight sternocleidomastoid causing the ear to be the same side chin opposite self-resolving condition in 90% cases called as the wry neck right Klippel-Feil syndrome is fused cervical vertebra causing low posterior hairline short neck decreased neck movements. Pseudohypertrophy of the calf is seen in Duchenne muscular dystrophy. Right? On this, a child climbs on himself, called as the Gowers sign. Where he climbs on himself, called as the Gowers sign. This is Duchenne muscular dystrophy. When your foot looks like a toy of rocker bottom, it's called as congenital vertical talus or in correction of CTV, rocker bottom foot. It is opposite of CTV because in CTV you have equinus at ankle, varus at subtalar joint, adduction at forefoot and midfoot and cavus, that is increased arch. तो ऐसा लगता है कि वो एक bean shaped foot है, opposite of rocker bottom where it looks like a convex sole. Here it's inside, अंदर bend हुआ होता है. In CTV the treatment is very simple. बच्चा पैदा हुआ है first year of life, cast. Beyond 1 year, release the tight medial structures. Right? Release the tight medial structures. And beyond that, take out a wedge of a bone more the lateral side, less from the medial side. CTV can reoccur up to 6 to 7 years. That's why apply a splint called as the foot abduction or Dennis Brown splint for 6 to 7 years of life. During the daytime, apply CTV shoes. If the child is beyond 10 years, fuse the joints, talonavicular, talocalcaneal, calcaneocuboid, called as triple arthrodesis. Torus fracture is just like a Roman pillar. There's a bend at the base. Is buckling of the cortex, no break. When it bends without a break, plastic deformation. These are pediatric population injuries. But classical pediatric population injury, what is present is break in one cortex, green stick fracture. Congenital pseudoarthrosis of tibia is anterolateral bowing of leg. Pseudoarthrosis means formation of a joint between the bone. When you don't have radius, it doesn't mean you don't have radius. It means you don't have thumb. You don't have radial artery. It means you don't have the radial musculature. So this is called as radial hemimelia. Radial club hand. All right. Fibular hemimelia means fibular नहीं है, lateral side नहीं है. Smaller foot, fifth toe नहीं है, called as fibular hemimelia. When you don't have the great toe or tibia नहीं है, it's called as tibial hemimelia. And posteromedial bowing is a self-resolving condition. When the ulna becomes prominent because of radial problems, it's called as maid-lung deformity, seen in Turner's syndrome. It is just a deformity. Movements are usually good. Polio, the most commonly involved muscle is quadriceps, and the patient has to take support of his hand to walk, called as hand-knee gait. This is fusion of the fingers called as syndactyly. Right, this is the damaged upper end of femur called as Perthes. Pressure epiphysis, lower end of femur, lower end of fibula. Salter-Harris injury passes through the hypertrophy zone of the physis. When there's a physeal plate or epiphyseal plate damage, there's a longitudinal growth damage. In primary healing, there is no callus, so compression plating is one of the examples. In secondary healing, there is callus present, nails and cast. X-rays of knee and wrist can tell up to the 18 years of age. Usually in ortho, next investigation is MRI, and best is gold standard, that is diagnosis. Sundry appearance, Codman's triangle onion peel are wide areas of malignant tumors. Strep, Klebsiella, E. coli can cause chronic osteomyelitis. Right? H sign is usually seen on a bone scan, indicating sacral fractures. But one of the examples they had given was an MRI where H sign was shown. Tom Smith arthritis destroys the femur epiphysis. Ring sequestrum is seen in external fixators. And remember, sickle cell anemia, sickling was shown in an image causing salmonella infection. Brody's is subacute osteomyelitis seen in upper and good immunity. Peronekia is most common infection of hand, and Ferroneia is infection of the pulse space. Organism is always Staph aureus. Tuberculosis starts in the acetabulum or in the head of femur. Ankylosing spondylitis, young man, low backache, decreased chest expansion, decreased lumbar movements, right? Heel pain, eye swelling, right? And HLA-B27 positive. MRI is investigation of choice. Night pain relieved on taking salicylates, osteoma. In osteochondroma, more than 2 centimeters of cartilage thickness is malignant transformation. And chondroma is the most common tumor of hands and bones of hand and feet. Lytic lesion that can involve the joint is GCT. Fibrous dysplasia causes Sheffer-Club deformity, and then there's a McAcuin-Albright syndrome causing polyostotic fibrous dysplasia, precocious puberty, and pigmentation. Second decade metaphyseal lesion with Codman's triangle or sundry appearance osteosarcoma. Ewing's is second decade more than first, translocation 1122 and MIG2 is positive. Metastasis is breast, prostate, lung, and dorsal spine. Most common cause of fractures in elderly is metastasis. Electromyography is the best test for nerve recovery. For compression neuropathy, nerve conduction velocity. Ulnar nerve is behind the medial epicondyle and supplies the little finger. Ulnar claw hand, knuckle bender splint is given. Posterior torsion nerve causes finger drop. Wrist drop is radial nerve. Right? Adductor pollicis for book test. Ulnar nerve, Froment sign if it is paralyzed. FU. Median nerve, right? The part of it, anti-anterosseous nerve, causes OK sign involvement. Pen test, median nerve. Shoulder is the most common joint to dislocate. Last exam I had down and out. Acromoclavicular and coracoclavicular ligaments are damaged. Clavicle बहुत ऊपर उठा होगा. Cubitus varus, supracondylar. Cubitus varus, cubitus valgus, lateral condyle humerus. Radial head, posterior tortious nerve, finger drop, fat embolism, femur fracture, 48 hours, confusion, breathlessness, petechiae. Distal and radius fractures comminuted, give ligamentotexis. Tannenberg test for hip stability, gluteus medius minimus and hip stability. Intertrochanteric fractures, malunion. Lateral border touches the bed, usually fixed with nails more than DHS. Neck of femur, avian more than non-union, less than 60, screws more than that. You do hemiarthroplasty. If joint is damaged, arthritis, any age in neck femur, THR. Right? Sciatic nerve palsy or foot drop or the common nerve palsy, high stepping gait. दोनों में choose करना CPN palsy. Posterior tibialis tendon is inserting on navicular and fens behind medial malleus. Calcaneum fractures, bolus reduces, lowers, Gissane increase. Foot, eversion injury, deltoid, inversion injury, anterior talus-femoral ligament, any injury of the foot or in orthopedics, 6 to 8 weeks of rest. Cylinder cast patella, Bowler bronze splint for the femur, knee or tibia. Spondylolisthesis, slip of L5 over S1, hypophosphatemia rickets will have raised ALP but normal PTH. Osteoporosis, calcium phosphate ALP normal, tap high. Pages is osteoclast defect, there will be cotton wool skull. And remember, frac score. Tannenberg is superior gluteal nerve. Avinash, आएगा ये question, गलती नहीं करना बेटे. Frac score is assessment of fractures and osteoporosis. This is an image of below knee amputation, you should remember that. ACL, Lashman test, 20 degrees. This is Popeye ka image. Tendon, most common, supraspinatus. Housemaid knee prepatellar. This is AVN of the femur epiphysis called as Perthes, painless. SCFE, painful. Hypothyroidism, overweight, 11 to 20. CTV, clubfoot. 3 pearls of success, commitment. सोच लिया, अपने आप से वादा किया, तो मैं अपनी भी नहीं सुनता. Hard work, I should be the most hardworking person I know. भगवान सबका अच्छा करेगा. Have full faith. अगर मेरा सपना छोटा है, इफ आई ड्रीम लेस आई डोंट नो माई सेल्फ, डेयर टू ड्रीम, राइट। जिन्होंने सपना नहीं देखा तो फिर क्या फायदा। ऑलराइट, अब अगले 3 दिन नींद नहीं, शांति से सोना है। अगले 3 दिन खाने के बारे में कॉम्प्रोमाइज नहीं करना, आराम से खाना है। अगले 3 दिन लोगों से बात नहीं करनी, पॉजिटिव लोगों पर ध्यान देना है। अगले 3 दिन अपने आप को बोलना है, मैं खेलेगा, मैं खेलेगा, मैं खेलेगा, मैं डरेगा नहीं प्रतीक। अपने 3 दिन अपने आप को बात करना है कि तुमसे ये 3 दिन कोई छीन नहीं सकता। अपने आप के साथ रहना जरूरी है। तेरी किस्मत दा लिखा तेरे तो कोई खो नहीं सकता। जो इतिहास याद नहीं रखते वो इतिहास लिख नहीं पाते। बहुत बार लोगों ने देश में इतिहास बदला है। इट इज नॉट ओवर टिल इट इज। अभी गेम बाकी है। डोंट एम फॉर 150, एम फॉर 200। तू श्रम करा चल बंदे, जो उसकी मेहर होगी ऊपर वाला तेरी किस्मत फिर से लिखेगा। जो तेरा हो नहीं सकता वो तुझे मिल जाएगा। आओ मन में बोले हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन। हो मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन। होगी शांति चारों ओर, होगी शांति चारों ओर, होगी शांति चारों ओर एक दिन। हो मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन। हम चलेंगे साथ साथ, हम चलेंगे साथ साथ, डाले हाथों में हाथ। हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन। दिस इज द मोस्ट इंपॉर्टेंट वन। नहीं डर किसी का आज, नहीं भय किसी का आज। हम होंगे कामयाब एक दिन। हो पूरा है विश्वास, हो पूरा है विश्वास, हम होंगे कामयाब एक दिन। बोलो जय माता दी। ऑल द वेरी बेस्ट एंड हैप्पी 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 लोहड़ी टू ऑल ऑफ यू। लव यू, लव सेरेबेलम, गो किल इट, बाय बाय।